Hey, happy Sunday to you all. Well, I'm preparing myself for Apollo 24/7's Health Hour. My questions about dental health are ready. Are you ready with your questions? Well, I'm going to ask all my questions and doubts about natural teeth, my dad's dentures, my mom's root canal issues, and my daughter's whitening issues. So, what are your questions and queries about oral health and dental hygiene? Anything from dental decay, gum issues, or anything else that you want to ask, shoot your questions. I shall take these questions up in the live session where Apollo's senior dentist Dr. Ashish Kakkar is going to join us in a while. So join us in the live session and see you there, 11 a.m. sharp.
एक टैप में डॉक्टर, समय नॉट अ फैक्टर, सुबह से रात तक बुला लो बेझिझक, दवाई चाहिए एसएप तो बस एक टैप, हाँ बस एक टैप, दवाई 2 घंटे में डॉक्टर्स भी मिलेंगे, सिर्फ 15 मिनट में बस एक टैप, हाँ बस एक टैप, हैदराबाद टू बैंगलोर, दिल्ली चेन्नई डोर टू डोर, आ गया अपोलो, जल्दी से आप खोलो, एक्सपर्टीज के लिए बस एक टैप।
अपोलो की एक्सपर्टीज पाने के लिए डाउनलोड द अपोलो 24/7 ऐप। अपोलो 24/7 एक्सपर्टीज इज फॉर एवरीवन।
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar, welcome to Apollo 24/7's Health Hour. This is a show which is designed to give you information, and information is power. Today's Apollo's Health Hour is dedicated to healthy gums and teeth. We are talking about dental health, and our senior dentist and dental surgeon from Apollo White Dental Clinic, Dr. Ashish Kakkar, will join us very shortly. So get ready with all the questions that you might want to ask. And today's health quiz is going to be interesting because I have 3 questions where you can win prizes from Apollo Hospitals, Apollo 24/7, and also you can get discount vouchers, and we are giving away gift coupons. Please stay on till the last. Apollo Circle members, wait till the end when I'm going to announce a weekend offer specially for you Circle members. So let's get into our show. Before that, have you heard about the vaccination drive? Apollo is handling vaccinations all over the country. So if you are worried where to get your vaccination from, how to get yourself registered, then all your worries are solved. You just have to download Apollo 24/7. Then once you download, you can go to the tab where it says book vaccination slot, complete the form, that's it. You will get a call, which Apollo center, which time slot you have to be there, and what are the things that you need to carry. That's it, it's as simple as that. If you want to download the Apollo 24/7 app, you can do it right now. You can scan the QR code on the screen, or there's a link which is given in the chat box. You can tap the link and download Apollo 24/7. Get your vaccination right in time, especially all the elders who are 60 plus and people who are 45 plus with comorbidities. Please do not wait. Go ahead and get your vaccination scheduled with Apollo 24/7 app. So let's talk about smiling bright. Let's talk about our dental issues. Today's expert is a very senior dentist and dental surgeon at Apollo Indraprastha Hospitals, Delhi. Let's meet our Dr. Professor Ashish Kakkar, who is a prosthetic dentistry from USA, who has more than 25 years experience in practice and research, who's actively involved in clinical research on oral care, dental device implants and biomaterials. And this is the most important fact of his profile, that he's invented a US FDA registered instrumentation and methodology for dentin sensitivity analysis, which is patented. And he is a visiting professor of periodontics in Yenepoya University, Mangaluru, and adjunct assistant professor periodontics at Rutgers School of Dental Medicine, Newark, USA. Namaste, Dr. Ashish. Welcome to the show.
Namaste. Thank you for having me over, Jhansi. It's great to meet everybody.
Thank you so much, Doctor. So it's great that you're putting smiles back with confidence at Apollo White Dental Clinics. And I understand that COVID has affected all of us at some level, and dental health must have been affected with COVID. And what kind of issues have you found at your clinic while we were all locked down in the COVID times?
Yeah, I think the initial reluctance was due to the lockdown, the fear of the spread. And as we all know, the spread was due to droplets. And then droplets are very common in dental clinic because of all the ultrasonic instruments which are being used. So there was kind of a shift from patients who would come very regularly and they didn't want to come to us anymore. Emergencies were being handled over the phone and some video consults, but a lot of people neglected their oral health in the last 1 year. This is what happened. And then, honestly, when we see these patients now, we see a plethora of problems that, have been brewing over the last 12 to 14 months.
True. True. And once we understand that dental cannot, any issue of dental health cannot wait, automatically you put other fears aside and come. But then there are certain things that we neglect for a long time. What were these things that you found out in COVID that had sheer neglect के वजह से हमने क्या खोया है? And what were the things that we could have taken care of?
I think people neglected their health overall. I mean, people were sitting at home, waking up late, eating late. Maybe the hygiene levels were not as good because they were not going out. I saw a lot of people when we were video chatting, not even shaving over. So this is the effect of lockdown. So there was a generalized laziness that stepped in. And obviously that had a major effect on the oral health. I'm not saying that happened with everybody, but patients who were during the treatment who came back for recalls after several months had several issues. And one thing what I've noticed is people started cracking their teeth because of the stress. Yes, so the cracked teeth syndrome, or which is now being named as COVID cracks. So the lot of stress, maybe job stress, maybe all kinds of stress. Even teenagers who were sitting at home taking online classes, people were clenching their teeth. And because of this clenching, the cracks developed. And a lot of patients later on had to go for extractions of these teeth. And this is very well documented in the literature in the last several months from very different countries, including Japan, US, the whole of Europe, and India, of course. So the COVID crack syndrome is something that has really led to people losing a lot of teeth. It's all due to the stress levels, I'm presuming.
So now it's called the COVID crack syndrome. Yeah. And we need to understand that why are you clenching your teeth? So is it because of any other reason, or is it because of stress? So agar stress hai to simple dental issue tak usko leke mat jao, other issues handle kar lo, right, doctor?
Yes, so there is ways around it. A lot of people have got night guards made so that they can break this habit. And as things are returning to normalcy, I think things will improve. We are all hopeful. But this last 12 to 14 months have been very traumatic for the whole world, rather. It's not unique to just only India. So we have to handle it in a very mature and a very structured way.
Understanding that while adults are facing these issues, kids might be facing even more trouble, right? Especially the children who are in the school going age. Shedding of teeth se lekar permanent teeth tak. What kind of issues that you have found in school children?
See, most of the mid-school children who are between the age of 9 and 14 would be in a mixed dentition stage.
Correct.
What happens in mixed dentition stage is, your milk teeth start shedding off and the permanent teeth start coming. And a lot of times the milk teeth are quite stubborn and they don't come out that easily. So, a lot of patients did suffer, got phone calls from their families that this tooth is not coming out, there is bleeding around this tooth, but I can see the permanent tooth come out from the bottom. What should we do? So, we try to help as much as we can. Some patients even came to the OPD with all PPEs and everything because they could not take the pain and the discomfort. But yes, in general, a lot of patients were not given the attention that they should have got because of this deadly disease.
Correct. So while you were talking about the precautions that were taken care by patients while wearing PPE kits, I understand that the hospitals, especially Apollo hospitals, must have taken extra precautions, and there must be newer techniques to address the issues that we have. What are the newer procedures or treatments that are being offered at Apollo?
See, I think Apollo Indraprastha is where I work, and I think it is one of the safest hospitals. During COVID, we did not get even one patient who got infected. So the numbers were low. They were all doing precautions. Rooms were being sanitized after each patient. The aerosol procedures were cut down so that, the spread doesn't happen. All the staff were wearing their gear, the PPEs, the N95s, the face shields, and the physical distancing of 6 feet was very strictly enforced. So, from that point of view, we all felt very safe, and we were working on call roster. So a lot of my colleagues were also coming, and fortunately, nobody got sick, and patients got the health care and the dental care that they should have got, even when it was not pandemic. So the same quality of care was given. Having said that, we also incorporated negative ion generators. As we all know, the virus is positively charged. So, when the negative ion generator is switched on, the cluster for the viruses forms and it gets heavy. This virus is very light. So it gets heavy, it falls on the surface. So the surfaces were disinfected with hypochlorite. We got UV lights into our surgeries. And we were trying to do more of a contactless system for like doing impressions using scanners, sending the scans to the lab by email instead of doing impressions and having saliva contamination, which was safe for everybody, including the healthcare workers, the doctors, the patients, and as the chain goes on to the lab as well. So, all precautions were taken, and I think this is the standard of care that we are very proud of.
Wonderful, doctor. We're very happy to hear that. We assured actually to say, do not avoid dental health issues, right time pe pahuncho, and then right care le lo. And how about the cosmetic dental procedures and what are the latest advancements, doctor?
So I think what is happening is people are now realizing that there's something that they wear every day. That's their face. So your face is the gateway to your personality. And, the number of working women and working men in their youth, in the young ages between 25 and 35 has increased drastically. You see in all the families now, both the husband and the wife, they are working. So everybody wants to have this self-confidence. Everybody wants to look good. Everybody wants to have a nice, pleasing smile. From that point of view, there is various cosmetic procedures which we are offering, right from bleaching to orthodontic correction, even for adults doing invisible braces or aligners, which is popularly known as Invisalign. That's a brand rather. And we are also doing smile designing to correct the gummy smiles. In very advanced cases, we are also doing some surgical procedures to set back the jaw so that the whole jaw system looks very, very appealing rather than different. So there is so many procedures which are available for our patients. The choices are immense. The materials, the technologies have really taken us to a different level where the treatment is very predictable and it's really very pretty, when the treatment is finished. I mean, last year, just before the lockdown, I was one of the smile judges for the Femina Star Show. Wow. And I was amazed to see the talent that these little kids have and how conscious they were about, the way they walk, the way they dress, the way they want to, smile. So there's a good talent in our country. I'm definitely positive about this. So we can offer all kinds of cosmetic treatments, and the good thing about our services is they're not cost prohibitive. So it's very, very reasonably priced.
Wonderful. So doctor, as we talk further, I have a few more questions for you, but I'll reserve my questions as of now and I'll get into the questions that are asked by the audience. Audience, I know that you would want to ask a lot of questions before you visit the dentist. So this is the chance. We have a professor who's senior dentist sitting with us today, and you can ask all your questions. Any question, however simple you think, you please go ahead, type in the chat box, and I'm going to place it before Dr. Ashish. Dr. Ashish, the first question I received today is about, yes, it's about a TMJ stuck issue. I'm not sure is it the jaw, TMJ? Yeah, I think it's that. There's a clicking noise from my jaw. Who should I consult? Is Invisalign a solution for this?
It's a complex problem. Let me explain you what the TMJ is. TMJ is the temporomandibular joint. if you see our head is fixed, the only movable part in our face is the jaw, the lower jaw. So
Yeah.
that is fixed on bilateral with a joint on right and left side, which is called the temporomandibular joint. Now, a lot of times due to stress, due to several other reasons, due to arthritis or due to other systemic disease, you start getting some derangement in the joint. But what we have seen is in the younger patients, it's mostly due to stress. They may be clenching or grinding their teeth. And I think this has gotten amplified, obviously, as we discussed a few minutes ago, due to the lockdown period where the stress levels were high. And I would tell everybody to just ask your partner to notice, when you're watching TV, working on a computer, if you're clenching your jaw or grinding your jaw or any other activity which is called parafunctional, which is not within your function, then you can really stress your joint and get TMJ issues. In this specific case, the patient is asking it has gotten stuck. So this is probably a dislocation of the jaw, which needs to be treated either with some steroid injections or with some surgical procedure. But if it is happening on a recurrent basis, you need attention because it's not going to go away on its own. After this treatment, yes, you can wear a splint, which will prevent any of these further activities. But any TMJ injury or any TMJ issue is a long-term treatment, very similar to any other joint in the body. So that needs to be attended.
So according to you, who is the person that she has to go to?
She can see an oral surgeon. An oral surgeon would be probably the best part, to do the surgical work. And a prosthodontist can make the splint because the splint needs to be designed in harmony with the bite of the patient. So that is something which can be fabricated. And again, we have superb softwares these days which simulate patients' jaw movements and things like that. So, it's not as complex as it used to be several years ago.
Okay, so that's an easy answer. I'll put the answer much easier for you, Lalita. You can just visit Apollo White Clinic and they will guide you who you have to visit for your TMJ issue. Right, doctor? Yeah. So next question is, I don't think I've got it checked, but I believe my gums are weak. While brushing, blood also appears. So they've not gone for a checkup.
Mm-hmm.
काफी बार होता है, bleeding of the gums, we take it for granted.
Okay, Jansi, let me ask you a question. If your finger is bleeding for 3 days, what would you do? You would run to a doctor. It's a part of your body. So is your teeth and your gums. And if your gums are bleeding for several weeks, why would you neglect it? I mean, it's as much a part of your body as any other organ or any other part. It should
point
not be
blank, doctor. Point blank. No answer, no coming back. No dental issues should be avoided.
Yeah. So I think it is important not to neglect this because this is the beginning of a disease which is called gingivitis. Now, gingivitis is just inflammation of the gum. Now, this inflammation is because of the fact that a lot of people are not brushing with the right technique. I'm not saying they're not brushing. The technique of brushing is very important. So there is biofilms that form on the teeth. And these biofilms host thousands and lakhs of bacteria.
True.
And the bacteria can be of several specimens. There can be 500 different specimens of bacteria. So think about it, you have a full bacterial focus of load around the gateway of your body, and you are ignoring it. And your body is telling you signs and symptoms. Okay, I'm hurting, I'm weeping, I'm bleeding, I'm in pain, but no action is taken. This is very important. So we need to make sure, we need to ascertain that we are going for a regular checkup to our dentist. Cleaning is required at least once every 6 to 8 months, especially in patients who are compromised. Now, in patients who have diabetes or patients with radiation therapy or patients on immunosuppressant, all these kind of patients who are on multiple drugs, these diseases can get amplified several fold. And this is, a fine line between losing a tooth and keeping a tooth. So I'm not saying this is going to happen overnight, but the final scene in the movie would be the end. So that is what we need to understand. We need to be very, very careful and we need to make sure that we are taking care of our gums and our teeth like we do for our hair and our skin. So
Yes, doctor. जो दिखते हैं उनके लिए तो काफी we take care. But जो नहीं दिखते हैं या actually दिखते हैं.
दिखते
Why am I
तो
saying
हैं,
this?
बट हम देखना नहीं चाहते हैं बिकॉज आपको नहीं दिखते हैं, दूसरे को दिखते हैं.
Exactly.
That is important.
Yes. Doctor, this is a personal question from my end. As you were saying, as we were speaking about people who have issues and neglect them, but there are people like me who are very complacent, thinking that, oh yeah, my oral hygiene is really good. I brush thrice a day and I have great set of teeth. I don't have issues. But people like me, now I haven't gotten back to my dentist after COVID. That means it's almost like more than a year and a half that I haven't visited my dentist. Am I getting complacent?
Well, I think if you have the self-confidence that you're brushing 3 times a day, which I think is an overkill, you should not be brushing 3 times a day because
Actor, doctor, the problem of an actor, the problem of a person who's always speaking to people.
I agree with you, but I think overbrushing can cause some erosions in your teeth and it can actually wear off the enamel. So if you are doing that, you should use a very super soft brush. Okay, so it's not the paste which is doing the action, it is the brush. Because paste, you know what toothpaste contains is soap. All the toothpaste companies are soap companies, if you see. They're all soap companies and they have just graduated into making toothpaste. So it's important to, once a year at least, because there's a lot of things that can remain silent if there is a problem. So it's important to visit your dentist just for a quick checkup, say hi, have a look. If x-rays are needed, do the x-rays, and if you're free, then you're good. I mean, I'm sure you're doing a great job, but there is a lot of people who have not visited dentists. I see patients who are in their 40s, and then I take their history. When was your last visit to the dentist? They say never. So that's a problem, from my end, because now they're at a stage in their life where, they're not getting any younger, and body starts to degenerate after 45. Think about it. It's important to kind of maintain what you have. So you're not 25 anymore. So that's what we need to put across.
I got my kick, so I'm going to see my dentist as soon as this episode is over. Okay. I'm going to schedule an appointment. All right, next question is from Mr. Anil Kumar, who says that he still has his milk teeth and his age is 65-year-old, as the dentist has informed him कि वो shed नहीं हुए हैं. So is this a problem? Is there anything to worry?
At 65, I don't think it's a problem because a lot of times what happens, this is a condition called hypodontia, where the teeth, the permanent teeth don't develop. And it's not very uncommon. Usually it's the upper, the incisor teeth or the lower premolar teeth which are there. A lot of times the premolar, these milk teeth will not shed because they have a very firm hold. Usually what happens is as the permanent tooth is erupting, it just pushes out the milk tooth. So I don't think he has much to bother if he's at 65 years of age. If it's not infected, if it is not carious, he can just leave it alone. If there is caries, he can just get it restored. And he can keep it for as long as he can. And if it does shed off at some point in time, replacement is possible for that.
Okay. So the next question is from Rahul. He has had braces for 4 years and he's removed them now. I'm 18 right now. I feel my teeth are a bit shaky. I've experienced this right from the year I've started wearing braces. So any tips for him, doctor?
So what happens in the braces treatment, the intention is to move teeth. So obviously all the kids will feel that the teeth are moving because they're actually moving. You're moving all the crooked teeth towards their ideal position. Now, post-treatment, it is important for patients like Rahul, who are now in their late teens, to wear retainers because the treatment is not over till your retainer treatment is done. Braces are off, which means that the active treatment is over. See, the teeth are attached to the bone with a rubber band-like structure. So you kind of pull that, stretch the rubber band. And if you don't retain it over there, the teeth start to walk back into that position. So it's important to wear the retainers for an extended period of time and especially if in his case he's now 18, he should consider permanent retainers and go back to his orthodontist for taking the suggestion.
All right. So Ashok Nair's question comes next. He had undergone an MVD surgery 3 years back for the 7th cranial nerve on the left side of the head. Now having pain in the teeth on the right side. In fact, the entire right side is painful. Kindly advise.
So if the whole side is painful, he needs to first investigate what the cause of the pain is. Maybe he does need to get a CBCT done. Maybe it could be a localized problem from a tooth point of view, or it could be a nerve problem. So then it needs to be figured out whether it's a dental issue or a neurological issue. Usually in a dental issue, there is pain associated with hot and cold temperature, and all dental pains would have some sort of swelling at some point in time. So if that's not happening, then it is probably a neurological issue. So he needs to consult both the dentist and the neurologist to, go to the right path. And facial pain is very common, especially if you have neuralgia issues. So trigeminal neuralgia is something which is getting more and more common, and the line of treatment is completely different from the dental treatment.
Okay, so I hope you got your answer there, Ashokji. Then next question is from Shweta. Prognosis, what's the prognosis of endo-RCT treated tooth lifelong? Ye likha hai, doctor. I didn't understand the question. I hope you got the question.
Okay, so she wants to know if her root. Why didn't your teeth last lifelong? That was my question to her. So, any intervention, any procedure which is done on the nature's creation has a life. No matter how much you say that, this is going to be lifelong, there is a chance of failure or chance of recurrence, which is there. Having said that, the success rate of root canals is over 95% over a period of 10 years. Some patients, my father was a dentist, so I'm still seeing his patients which were done like 50 years ago, and the root canals are still intact. Not all of them, but quite a few of them. So this is difficult to put a number on any treatment which is done with a medical science. But if the root canal has been done properly, it should serve you for the next 15 to 20 years without any issue.
All right. So ये जनाब next जो question पूछते वो थोड़ा I can see myself there. Prithvi is asking this question. If the teeth are not white due to overbrushing, is there any treatment to get the teeth color a little whiter?
Okay, how little is little? So that's my question. Now, that's something that a lot of patients come to us for. Now, the staining of the teeth is either extrinsic or intrinsic. Now, the extrinsic staining could be because of your food, like all the masalas that we Indians have. It could be tea, coffee, wine, smoking, all kinds of other tobaccos and stuff like that. Those can easily be removed by scaling and polishing to some extent. Now, the intrinsics, and then you can go and whiten your teeth. There is no problem. You will get like a significant amount of whitening. But if there is intrinsic staining, which means that the teeth color intrinsically is different, which means that there is a tetracycline staining, which means that some medication has been given to them as very young children when the permanent teeth are developing, it tends to go and embed within the surface of the tooth. So it becomes an inherent part of the tooth structure, the color. So, or fluorosis. So a lot of people do underground water. Not everybody has city supply. In the villages, there is wells and everything. So those, sources of water are very high in mineral content. And during the developing stage of the teeth, these minerals can get deposited inside the teeth. So that is irreversible. Similarly, if you have a high fluoride diet, similar fluorosis can happen. So there's so many factors. So you need to ascertain whether this is an intrinsic staining or an extrinsic staining. And both the treatments have completely different paths. One can be treated conservatively. The other has to have a little more invasive treatment. But yes, there is hope for both of them. Yes.
Hiren Misri ka next question hai, doctor. He doesn't have problems of teeth, jaws, or gums, but provide me with best practices to retain good health of oral hygiene. Help me with good brushing techniques.
Okay, so brushing technique, you need to brush twice a day, preferably after breakfast and after dinner. That is the norm internationally, but I think in India we don't want to eat our breakfast without brushing, which is fine. I mean, you can do brushing before breakfast, after breakfast also, but you can do a nice rinse. So twice a day, you need to brush vertically. Don't need to scrub the floor, like go round and round, because if you do vertical strokes on upper teeth, you go down, and the lower teeth you go up, and then you can go scrub, scrub, scrub on the biting surfaces. That really helps. Use a soft brush. Keep your bristles at 45-degree angle to the teeth, and then just gently sweep them down. So that's very important. If you are getting food impaction in between your teeth, flossing is very important, because these lunch boxes in between your teeth are good source of food for the bacteria to multiply. So that has to be completely eliminated. And if it is a recurrent problem, you need to show to a dentist. So dentist visit once a year at least, for patients who are very careful, is very important. Just to get a good tick mark, get an A grade on your report card.
Yeah, that's nice. As you were saying, doctor, people with slightly more health issues like diabetes or other issues, they need to be conscious of their health. Mr. Jasveer Singh Bhatia is asking an interesting question here. Thyroid ke bare mein inka question hai. Does thyroid impact dental health?
Jasveer, thyroid per se will not do that, but thyroid can actually have other systemic issues where, if you do have like blood pressure and other things can happen. But thyroid per se will not cause any dental issues. But some certain medications which are given can cause dry mouth, can cause other oral issues. So that you need to be careful about.
Okay. Vasudha Rani's question comes next. How can, I'm sorry, let me rephrase the question. Okay, she has bad odor basically. How can she stop this?
Okay, so the odor as such, is very similar to the odor that you get with sweating in concept. So if you see the sweat doesn't stink, it's the bacteria that degrade the sweat that stinks. So similarly, the odor is not from the food, it's the bacteria which are fermenting the food. And these bacteria can be present not only around your teeth, but also on your tongue and on your palate. So the tongue has a big reservoir because tongue is not smooth, it is very rough. So I would definitely recommend tongue cleaning for patients who are having bad breath, odor, in spite of keeping very good oral hygiene. So there is two factors. You need to have a good oral hygiene, and then you need to have a clean tongue and a palate. So, you could just quickly brush the palate as well, lightly, so that there is no food particles or anything over there. And a tongue cleaning is really very, very important, because that harvests more bacteria than the teeth and the gums and the pockets together.
Okay. So here's an interesting question. As you said, the larger section of India has dental se zyada gum ka problem hota hai, is what I understand. Sumit Sarkar's question says, how to prevent gum recession? How to recover to previous state from this issue?
Okay, so that's Sumit, that's a difficult situation. When you've lost the gum to recession, see, please understand the gum is being supported by bone. So there is a tooth, and around the tooth there is a bone, and the gum is like a jacket that goes around the bone. So if you don't have the skeleton structure of the bone, the gum is going to drop down. So what happens is, this is part of the gum disease. How it starts is with gingival bleeding or gum bleeding, like our first patient asked us, why is my, what do I do if my gums are bleeding? So as the disease progresses, you start getting more inflammation, and then these biofilms around your teeth will start getting calcified. So that forms a very hard layer of calcium, or which is called dental calculus, which will in turn harvest more bacteria, and the bacterial structure then changes to a little more virulent bacteria that starts eating up into your bone, which surrounds the tooth. So ultimately, if the bone level is here, it starts coming down, 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 then the teeth start getting mobile. And this is where the periodontitis or the pyria, which is commonly called. So once you started losing a little bit of gum, it's important that you go to your dentist and find out what is the reason for it, whether you have active disease or the disease has stopped. If there is active disease, then you need to get certain treatment done. There is certain procedures like bone grafting and gum grafting, which will help to recover this recession to a certain extent, but you will never get 100% recovery. So it's important to preserve what you have so that you don't go further down and deteriorate further down.
Okay. Ramya Nagraj पूछते हैं कि tooth brittle है, blood in gums है. Do I need to remove or get a root canal done? Any tablets as a precaution for toothache?
Okay, so no tablets over the web unless a dentist has seen you, because toothache could be because of several reasons. You have to see the dentist and figure out कि आपको दर्द क्यों हो रही है, किस लिए हो रही है, क्या कीड़ा लगा है, गम डिजीज है, क्या रूट कैनाल की जरूरत है. So yeah, wisdom tooth impacted hai. So, and sometimes, as the other patient had asked us, it could be a neuralgic pain which is localized to the tooth. Sometimes there is infection in the sinuses and the upper teeth, तो उससे भी tooth में दर्द होती है. तो इस तरह हम बिना examine किए patient को, बिना देखे, बिना x-rays के आपको भी दवा ऐसे नहीं लेनी चाहिए. You have to take it under medical supervision. If your teeth are brittle, there has to be different reasons. Maybe you have lost some enamel, and then this is the teeth are getting unsupported, and they're just shedding off because of that. So you definitely need a dental exam at as soon as possible.
Syed Haruni ji ka question hai, 2.5-year-old, 2.5-year-old child hai inka. His teeth are full of decay and a few of them have broken. A dentist had suggested to go for root canal once he is 6+. Added to this situation, he fell last week. That's it. That's the question.
That's not good news. So when you start getting decay on such young children, it is usually related to bottle caries, like nursing bottle caries जिसको कहते हैं. तो वो क्या होता है कि माँ बच्चे को दूध पिलाती है रात को, तो उसके मुंह में बॉटल डाल के वो सो जाता है. So what usually happens is that the lower teeth are protected because of the saliva wash. Saliva has a very good buffering capacity. तो saliva से lower teeth ज़्यादा effect नहीं होते, but upper teeth don't get that kind of saliva. So you start getting a generalized decay on all the upper teeth which are there, especially if it's 2.5, it's going to be 3 or 4 teeth on the upper, 3 or 4 teeth on the lower. So maybe the incisor itself. It's not a very uncommon thing. So we have to educate the mothers and tell them that, if the child is having bottle while sleeping, you make sure that you at least give some water after that, so that all the milk proteins, everything is washed off. Because if it remains there, then there is a problem with decay. So root canals will be needed depending on the clinical situation. Too young right now to do it. I would suggest to see a pediatric dentist and take the opinion. Some x-rays would need to be taken. And it is compounded by the fact that the poor child has fallen down. So definitely attention is needed as soon as possible.
All right. There are 2-3 questions which are talking about general health, the diabetic issues and dental health. BB Grover, then Mr. Jasbir Singh, and somebody else also was asking. So what is the relationship between general health, diabetics, and oral health?
Okay, so that's a very important question. Basically, what happens is that, as I said, teeth have biofilms, and biofilms host reservoirs for bacteria, and there's 400, 500, 600 different kinds of bacteria which have been identified. And it's not new to see this. The focal infection theory 1920s के अंदर certain scientists had advocated, but that was never proven. So the cardiovascular disease, it can happen because it's also an inflammatory disease. So the bacteria can travel just like cancer, metastasis जिसको कहते हैं, उससे bacteria भी travel कर सकता है into your heart organ, and you can start getting cardiovascular diseases. Both atherosclerosis and gum disease have very similar bacterial compositions and similar inflammatory markers. So that has now been proven in the last 10 years. There is a lot of work going on in Harvard University. So obviously, if you keep your teeth clean, you will live longer, you will have a better heart. It is now being proven. Bacterial pneumonia is also very common because the same bacteria can go down your lungs and cause pneumonitis. Diabetes mellitus and low birth weight of children has also been associated with patients who've got very high index of periodontal disease or gum disease. So it's important that you don't ignore this. And if you have bacteria, the inflammation goes up, then similarly, it's a vicious cycle. So if you have diabetes, the inflammation for the gum goes up. If you have inflammation, the diabetes goes up. So you have to control both because it will keep cascading this way. Try and maintain your HbA1c levels below 7. For diabetics, it's important to keep it below 7. And it is not safe to do any dental procedure, especially involving any surgical dental procedure, if your HbA1c is above 7. You need to be very, very careful from that point of view.
Okay, that is something that one has to take care. Hiren Mistry ji पूछते हैं कि is betadine good for removing bacteria from mouth? If so, how to use it?
Well, there is a betadine oral rinse which is available. I think it's been there for decades and centuries now. It's basically an iodine-based mouthwash, and it's the similar composition of the disinfected surface disinfectant which is used prior to the surgeries of your skin or abdomen or whatever. So it's very effective. So the mouthwash can be diluted about 10 ml in 10 ml of water, and you can use it twice a day. And the only drawback with that is sometimes you do get staining because of the iodine. But that's, I mean, if you are trying to prevent a certain disease, especially in scenario like today, any medicated mouthwash containing CPC, betadine, or chlorhexidine has good antibacterial properties, but they all have, some of them have drawbacks of staining teeth. So you have to be careful from that point of view.
All right. So that doesn't mean that we go, somebody like me, I'm talking to myself, doctor, कि ये बात मैंने सुन लिया कि एंटीबैक्टीरियल प्रॉपर्टीज है, गम हेल्थ बढ़ाएगा, तो दिन में 10 बार मत कीजिएगा. So
yeah, that's very important. उसको उतना ही यूज करना है जब आपको जरूरत है, और अगर आपके स्टेन हो रहे हैं टीथ उसके बाद, तो then you will definitely need to remove those stains.
So what is the recommended routine, doctor? Is there something which is a standard protocol that once, twice of rinsing and gargling?
Basically, rinsing should be done after every meal. You have a guest? So rinsing should be done after every meal. It's not important to use the mouthwash as such, but what rinsing does is actually forcefully remove all the food debris which gets stuck between the teeth. It's just pulling the water through the gaps of the teeth and making sure that there is no debris remaining. It doesn't have to be a medicated mouthwash unless you have gum disease, but it's important to use a medicated mouthwash for people who have gum bleeding and things like that. So if you're rinsing even with plain water or even normal saline and making sure that there is no food stuck in your teeth, you're good. You're good. There is no problem.
All right. Thank you so much. Shubha Nair is asking next question. What are the ways to avoid a root canal? It's painful.
So the way to avoid root canal is not to get cavities. So
Okay.
if you don't have a cavity, you don't get a root canal. So I'm assuming that Ms. Nair has a cavity where her dentist has told her that, it is deep enough to, now we have to approach it in a different way. So this is again going with the dental problems. So what do we do when we have dental pain? First thing, what do? We call up our chemist. मेरे दांत में दर्द है, दवा भेज दो. ठीक है? So then the chemist will say, अच्छा ये doctor ये prescribe करता है, he sends the medicine. Still it doesn't get okay. Then what do? You call up your doctor. Doctor साहब मेरे दांत में दर्द है. वो कहेगा अच्छा take this medicine. Another 3 weeks gone by. Then you say now it's still not getting okay. Now what do? Finally they will make kuch himmat jata ke, then they will go to the dentist. And by that time what happens? Things like this. You end up getting into a root canal. So please don't ignore any dental issues. The first sign of and symptoms of pain or discomfort or anything unusual that you feel in your mouth, please visit your dentist. We are all here to help you and prevent issues like what is happening over here with Ms. Nair, because if this had been attended to a while ago, this could have been a simple filling.
Okay. So it's like, जल्दी पहले तो प्रॉब्लम को इनवाइट मत करो, अगर जब प्रॉब्लम शुरू होता है तो उसके ऊपर बैठो मत, इग्नोर मत करो, right? So but doctor, let me understand what's the fear of visiting a dentist. This has been an age-old problem.
I think it's the overwhelming instrumentation and the fear of the unanticipated. A lot of times our procedures are not very painful. Everything is done in controlled environment with local anesthesia, but it's the history, because historically dental treatment has always been painful.
Correct.
And people do get apprehensive. But having said that, in today's day and age, I would say even extracting a wisdom tooth, which is impacted in the bone, doesn't cause pain at all. I mean, the anesthesia depth and the quality of the techniques and the instrumentation available are so good that about 90% of us are very safe, and these procedures are absolutely painless.
Okay.
And even now we started using lasers for preparation of cavities. So hard tissue lasers can be used. So minimal amount of anesthesia or no anesthesia is required. Sometimes these children come and we are preparing their cavities with laser. There is no sound of the drill. There is no vibration. So, the mothers say, "Arey, ho gaya?" Say, "Yeah, it's done." So there is nothing, no sound, nothing at all. So you need to upgrade your equipments to overcome the fears, and you have to keep talking to your patients and tell them, yes, these are the things available, and you will feel better with these.
Correct. And also, like, I suppose the patient's experiences when they are shared that, yeah, this is quite a simple procedure, that also helps gathering some amount of confidence.
Yeah, I think it's just by word of mouth. I mean, one patient who goes happy and says, okay, I didn't have pain, is more important than putting a Facebook post, or, because that is your best advertisement.
True. Yeah. अच्छा डॉक्टर मिस्टर शत्रुघ्न महतो पूछते हैं कि उनका swelling and pain of teeth recently होता है, and this is after his cataract surgery. कुछ इनके बीच में कुछ link है क्या?
No, there is absolutely no link in these things. I've heard this before, that, I will not get my teeth extracted because it's going to affect my eyes. There is no relation. There's a lot of myth about dental treatment. Please, I mean, it could be absolutely coincidental that this has happened. So you need to consult your dentist. But one word of precaution, after any eye surgery, you need to wait 4 to 6 weeks, because you don't want the aerosol to go into your eye and contaminate your lens or anything. So conservative treatment should be done. We personally follow about 4 to 6 weeks of time lag between post-eye surgery for any dental procedure. So that's a word of caution.
Okay. Quickly, because we're running short of time now, I have 2 last questions for you, doctor. Sean David पूछते, is it okay to use dental floss for removing debris from the teeth, and in addition to rinsing?
Yes, I think it's very important. I mean, as I said, the dental floss is a very, very good tool. It takes time. You need a lot of patience, and but it's really effective in removing, especially for removing fibrous foods or leafy foods, which get stuck between the teeth. It is important to use dental floss. So it's going to really enhance your oral hygiene, because where the cavity starts is in between the two teeth, which is not visible. So it's important to do that. Yes.
And almost the last question, Shubha Nair again comes back. My teeth generally pains when I eat ice cream. I suppose she's asking about sensitivity. How can I enjoy ice cream once a week without worrying about my teeth?
Again, I think you need to see the dentist and figure out why you're getting sensitivity. Sensitivity, as I said, Jansi, for you too, as I said, if you're brushing too hard, brushing too frequently, using gel toothpaste, which are more abrasive than your normal white toothpaste, calcium carbonate base. All these factors do contribute in removing tooth surface, which is sometimes iatrogenic in nature or patient dependent. Also, if you have acidity, you can get erosion of the teeth. So all these factors do cause sensitivity on people's teeth. And if there is issues like small cavitations, it can easily be taken care of, sometimes even without using the drill to fill up these small cavitations. So important consult from dentist, and you're good to go with maybe twice a week instead of one with the summer coming.
All right. So one last question for myself, and this is because my father uses dentures, and I'm always worried if he's cleaning his dentures well. So any suggestions there?
Again, dentures are not brush-free analogs of your teeth. They have to be brushed. A good way to do it is with soap and water. There is specific dental cleaners, denture cleaners, which are available, which are peroxide based. And so they just have this effervescence. So they completely clean the surface. And maybe once every year, you can send them back to the dentist for them to get polished. And that's about it, really. I mean, dentures are good prostheses, and patients who wear dentures, they swear by them. So
the denture cleansers are enough, right? So
that's more than enough. So it's not only the denture surface, it's also the fitting surface of the denture. Both the sides have to be cleaned.
Okay.
So that's important to understand.
Thank you so much for the patience in answering all these questions, Doctor. And before we take leave from you, can I get some top tips to take care of my smileys?
Okay, Jansi, I think we've covered a lot in this short time. So basically, as I was saying, brush twice a day, use the right brushing technique, dental floss, visit your dentist every 6 months, a dental cleaning at least once a year. Do not ignore any symptoms which are there in your mouth, and enjoy yourself. Don't get stressed out. We're all going through some hard times. Don't clench your teeth, and trust your dentist. We're always around to help you out, even if it is for the slightest of the problem. Thank you.
Wonderful. Thank you so much, Dr. Namaste, once again.
Namaste to everyone, and thank you for being on the show.
Thank you, and bye. All right, so that is Dr. Ashish Kakkar giving us answers of keeping our dental health up. And now it's your turn to win some exciting prizes from Apollo's 24/7. And here's health quiz coming up. You have to answer these questions in the chat box. I'm going to ask you 3 questions. Please mention question number 1 and your answer, question number 2 and the answer. You can participate for all 3 questions. And the winner's name will be announced towards the end of the webinar. Winners, once you are announced as a winner, you have to mail your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. Get ready. Here's question number 1 for today's health quiz. Which is the hardest substance in the human body? Which is the hardest substance in the human body? Answer pata hai to type kijiye. Nahi pata hai to you know what to do. Google, search karo, answer bhej dijiye. Question number 1. What is the hardest substance in the human body? Ramya Nagaraj teeth bolte hain. Thoda aur detail mein jaiye, Ramya. We are looking for a very specific answer. Something related to teeth, but what? All right, next question. Question number 2. How many permanent teeth do adults have? How many permanent teeth do adults have? Human ke baare mein pooch rahi hu. Let me be a little more specific in my question. Dr. Sachin Bhalla ने enamel करके लिखा है, श्री लक्ष्मी P. Denton करके लिखा है, So let's see. Ramya Nagraj, second question के लिए आपने लिखा है 32. But these, let me see if that's the right answer. Question number 3 coming up your way. How much time does it take to deliver medicines when booked through Apollo 24/7 app? How much time does it take to deliver medicines when booked through Apollo 24/7 app? That's the question number 3. And the last question. Right, all answers coming up. बहुत सारे correct answers मुझे दिखते हैं. Let me see what's happening with the winners. But before that, today is a Sunday, and every Sunday Circle members get something special from Apollo 24/7. And this weekend, Apollo 24/7 has announced a wonderful offer, the weekend offer, which is coming up on your screen. We're going to show you the offer. You just simply have to buy medicines worth minimum value of 300 rupees and use the code CIRTHE. That's it. The perfect gift for changing temperatures is Apollo's thermometer. You get the thermometer at no cost. It's the Apollo Digital Flexi Thermometer, which is absolutely at no cost. The minimum order value is 300. This is the weekend offer on Apollo 24/7 only for Circle members. The code is on the screen. Please go ahead, buy the medicines today. Today is the last day to avail this offer. Huh? Okay. And you know about Apollo 24/7, but you want to know more about the benefits कि 15 मिनट में आप डॉक्टर का कंसल्ट कर सकते हो, 2 मिनट में आपके मेडिसिन आ जाएंगे, and all of that. Here's an AV which can show you how you can use Apollo 24/7.
एक टैप में डॉक्टर, समय नोरा फैक्टर, सुबह से रात तक बुला लो बेझिझक, दवाई चाहिए ए सब तो बस एक टैप, हाँ बस एक टैप, दवाई 2 घंटे में डॉक्टर्स भी मिलेंगे, सिर्फ 15 मिनट में बस एक टैप, हाँ बस एक टैप, हैदराबाद टू बैंगलोर, दिल्ली चेन्नई डोर टू डोर, आ गया अपोलो, जल्दी से आप खोलो, एक्सपर्टीज के लिए बस एक टैप।
अपोलो की एक्सपर्टीज पाने के लिए डाउनलोड द अपोलो 24/7 ऐप. अपोलो 24/7 एक्सपर्टीज इज फॉर एवरीवन.
Such a wonderful way to put it across. Very interesting television commercial that was. Get medicines delivered in 2 hours. मेरा आंसर भी वहाँ पर आ गया. And here are the winners for today. Sachin Bhalla, Ramya Nagraj, and Hiren Misri. Congratulations. Please do write back to us at Apollo marketing at apollo247.com to claim your gift vouchers from Apollo 24/7. And thank you so much all of you for joining us. It was very informative. आपके questions बहुत सारे लोगों को आंसर्स पहुंचाते हैं. So here's a small thanks from Apollo 24/7. Use this gift voucher, gift coupon Apollo 247 to get up to rupees 299 off on online consultation with Apollo doctors, and use coupon medicine10 to get up to 10% off on pharmacy orders. You have to log on to Apollo.24/7 app to use these coupons. Thank you so much all of you. Please do share your feedback, which is very important, and we shall keep doing this. These wonderful interactions with doctors, we'll keep getting them to you every week. Thank you so much for joining us today. Do send in your feedback. This is today's session. Write your feedback to marketing@apollo247.com. See you next time. Till then, please do take care of yourselves.